Post-industrial America spans during the years from the 1870s to the 1960s. So before we proceed, there was something that led to the industrialization in Europe, which also came to the United States. And this happened with the discovery of steel. Iron was already being forged. Well, there was a technology in using iron, but the technology to actually make steel from iron was developed, and this led to the development of factories, machines, steamships, and that has led to the Industrial Revolution. Now, after the Industrial Revolution, we have seen or we saw huge breakthroughs and improvements in the field of medicine. Also, during this time, the travel between the United States and Europe became so much easier. With the advent of the steamship, travel between Europe and America was greatly shortened and could be done year round and not depend on the seasons. Because before the steamships, it was wind powered. And why am I talking about this? Well, the fact is, traveling to Europe and the ease of travel to Europe facilitated Americans to send their sons to Europe. And I'm saying sons because mostly at the time, medical schools only accepted males, unfortunately. So there were a lot of middle class to rich Americans sending their sons to Europe to study medicine, and in return, they came back. And also, because of this increased ease of travel between the United States and Europe, a lot of the technologies were brought back. So the post-industrial era, what we saw was the growth and development of the medical profession that benefited from all those advancements that I have mentioned before. We also saw the urbanization of the United States. A lot of people were moving from the rural areas, and we also saw this in Europe. And the reason was there were more jobs in cities because of industrializations in the factories. Aside from the scientific discoveries that improved medical procedures and medical technology, reforms in medical education also happened during this time. And it was during this time that the framework of how we deliver healthcare in this country started to take shape. Also, at this time, medicine became an established profession and it became an organized profession. And there was a move because of advancement in medical science. There was a move for physicians to choose areas of specialization. And this cohesiveness in the profession led them or led the physicians to gain the prestige that they have today. Remember, in pre-industrial America, it was really an occupation without any prestige. Also at this time, hospitals emerged as a repository for high-tech facilities and equipment. Now, this is a very, very important landmark in healthcare history in the US. This developed that symbiotic relationship between physicians and hospitals. So because of the advancement in medical technology, a lot of these equipment became more expensive. They were bulky, they were huge. So hospitals became the places where you will find them. So doctors then needed the hospitals to use the equipment in the hospitals. In turn, the hospitals, for them to be financially viable and to gain revenues, they needed the doctors to bring in their patients. It was also during this time that private and public health insurance started to take roots. Post-industrial America also ushered in a remarkable event, which is educational reform not just in medicine, but in other professions as well. But it was during this time that the advances in the medical sciences that were happening all over the world prompted um, academic institutions to reform medical education. So around 1870, if you remember those medical schools I was talking about, which doctors have formed, they began to affiliate themselves with universities. And to this day, most medical schools are affiliated with universities, and the degrees are conferred by the universities. Also, affiliating with universities allowed these medical schools to be able to use resources that universities already have, such as libraries, laboratories, and things like that. It was Harvard that revolutionized medical education, and they did this by adopting the European model. The European model basically follows the academic year to have 9 months instead of having 4 months. So, literally, having 4 months each year is literally just having one semester per year. So, they increased the academic year to 9 months. To this day, the standard terms we have in an academic year, there are two: the fall and the spring semesters. Also, it became evident that more time was needed to impart medical instruction to medical students. So the the um, the length of time one would study to become a physician got extended from 2 years, and at this time it was extended to another year, and it went to 3 years. A lot of other courses, laboratory courses, clinical courses, sciences that supported medical technology were also included in the curriculum, like chemistry, physiology, anatomy, and pathology were added. It was not until 1893 that we really saw the educational reform that shaped the current academic training physicians have in this country. And it was through Johns Hopkins University when they opened in 1893. And they basically required that medical education become a graduate training program. So today it is a graduate training program. And they required a college degree as an entrance requirement. And they basically said there's too much advancement in medical technology that we cannot afford to teach. We won't have time to teach from the very basics. We only want students who already had the basic education and background in the sciences, natural sciences, before they join our school. And from there on, we're going to build on that and concentrate specifically on the teaching of medicine. The opening of Johns Hopkins Medical School is widely credited to have, to have made the US be able to deal with the pandemic influenza of 1918. And it is said that the development and the further refinement of the use of convalescent plasma um, was made possible by the researchers and the physicians that have benefited from this educational reform, be it from Johns Hopkins, graduated from Johns Hopkins or other universities. But because of the educational reform, um, it is said that all of these advancements in the academic training has led to a lot of the treatments that became available. So basically, convalescent plasma is taking the antibody from recovered patients, and they basically injected it to those people who are still yet sick. And it cut the mortality, the deaths in people with the Spanish flu, the pandemic at that time. One instrumental organization that furthered educational reform for medicine was the American Medical Association. So, what did they do? Basically, they were able to convince state legislatures um, to only grant licenses to physicians that graduated from medical schools that have been accredited by the organization. This also is monumental in terms of academics and education in the United States. You're probably aware that every college, even Bronx Community College, undergoes accreditation, uh, every number of years. And that practice started with the American Medical Association basically convincing state legislatures to require that a physician can only be licensed to practice in a specific state if they have graduated from a medical school that has been accredited by the American Medical Association. This was really good in terms of improving and standardizing the quality of education for physicians because the American Medical Association had a chapter in each state. To this day, that is the arrangement. There's the umbrella American Medical Association, and each state has its own chapter. So the idea was that chapter in that state will be the one to accredit medical schools. They will go into the school, study the curriculum, their manner of instruction, their facilities, and then they will basically accredit the school, which is in turn sort of like a stamp of approval. So states will then only give licenses to physicians that graduated from schools that have had received that stamp of approval from the American Medical Association. This made them a very, very powerful organization, which in turn also made physicians and organized physicians as a profession and made them very powerful and also contributed more to them gaining the prestige that they have today. One notable thing that happened during this time, if you remember, I mentioned that industrialization brought urbanization, so a lot of people were moving to the cities. What this led to physicians opening up offices. So before this time, physicians were doing either house visits or treating patients in hospitals. But because they can no longer attend to the number of patients they have in the big cities, they started establishing office-based clinics. And to this day, we have those as outpatient clinics. It began to replace house calls, and it also proved to be more economically viable for them because rather than perhaps seeing only 5 or 4 patients a day by doing house visits, they could see as much as 10 patients if they saw them, if the patients come to them. This also led to the development of the term ambulatory care because ambulatory means people can walk. So they realized that not all of patients were very sick. Some of them can actually walk to the office, the clinic, to receive medical treatment. Also at this time, medicine became more entrenched and driven by science and technology. And at this time, because of the development in educational reform as well as licensure that the American Medical Association has espoused, lay people could no longer just claim to be physicians. They will have to undergo all this academic training and be licensed. And again, the advances in medical technology. Let's go back to the American Medical Association and touch on this organization a little bit. So what it really did was, as I have mentioned, it helped galvanize the profession. And it was almost like a union, but not necessarily a union, but a guild, and a professional organization that protected the interests of physicians. And these led to the collective action that they have, and it was referred to as organized medicine, in contrast to the uncoordinated actions of individual physicians at the time. So they organized themselves, they became members of this professional organization. In turn, they become a very powerful force in the healthcare industry. So again, as I have also mentioned, AMA at the time and to this day have chapters in the different states, and it was also during this time that they were able to convince each state um, in terms of their conditions in granting licenses, and that was through the accreditation process done by them. There were some things that the American Medical Association today, there were ideas that they have espoused that you would probably be wondering about. At the time, they didn't believe that physicians should be employed, and that they didn't believe that there should be a third party or insurance that would be paying the physicians. So they encouraged physicians to be private entrepreneurs, which actually supported the model of providing care in clinics. And doctors would still be independent entrepreneurs even if they see their patients in the hospitals. They just see their patients in the hospitals. The patients would pay the hospital for the stay, but they would also pay the doctor for the services that they get. But doctors are not necessarily employed or are employees of the hospital during the time. Of course, that is no longer the case today. Most doctors that you see in hospitals are actually hospitalists, and they are employees of the hospital. So we actually have an entire session to discuss hospitals and how they have evolved into medical systems, otherwise known as integrated delivery systems. But I have alluded to this earlier. The current form or concept of a hospital that we have today formed during this time. And basically, the way hospitals have grown, they symbolized healthcare as being an institution. It became an industry in itself. And like I said, because of the advancement in medical science and technology, these facilities were expensive, they were bulky, and it was the hospitals then that bought them. And then the doctors would then need those facilities or those equipment to treat their patients. In return, the doctors brought patients to the hospital, and the symbiotic relationship started and became established. Another thing of note in terms of development in post-industrial America was the reform of mental health care in the United States. So there was a lot of emphasis on institutionalization, which gave rise to asylums, where people who have mental health disorders were actually institutionalized. They were basically treated like prisoners. But at the turn of the 20th century, the federal government actually supported research and education in the field of psychiatry. And it led to the concept of community mental health. So rather than people being institutionalized and being kept almost like prisoners, they could live normal lives, normal quality lives, stay in the community, be functional, be productive, and yet still be able to receive mental health services within the community.